Hi, I'm Jamie Marbo with Inspired Hygiene. Today I want to talk to you about an episode that happened to a patient of mine in my chair last week. My patient had come in, the patient I was familiar with, for his hygiene visit, and I had done all of the updating of his health history. He had several risk factors. He had heart problems, high blood pressure, he was on several medications, and he was diabetic. He had happily reported to me that his last HbA1c level was at a 6.5. So that was a big deal. And we thought, great, things are good. He's got his diabetes under control. And as I proceeded with the appointment, I set him back to do his probe readings, but got about halfway through and one of my admin people needed to ask him a fairly simple question. He was closing his eyes, so I thought he was just relaxing, and she asked him the question. He didn't respond, so I gently asked him if, hey, we've got a question for you. He didn't open his eyes right away, and it was becoming clear that he was either asleep or he was real groggy. And when we repeated the question a couple of times, he was confused and he didn't even know really where he was at. He was very disoriented. It became clear to me that he was probably going into some type of an insulin shock or hypoglycemic situation. So quickly we did the necessary things. I got oxygen on him. The girls, the admin staff member and the assistant ran and got orange juice out of the fridge and the emergency kit. And I gave him, in our emergency kit, we happened to have some glucose gel. So I administered to his mouth about 15 grams of that and put a little water in there for him to swallow it. It was about a 10-minute scary episode, and it was extra scary not just because of the episode at hand, but also this patient that I was familiar with was my father. So the quick reaction and getting his glucose level, blood sugar levels up was scary, but it worked out in our favor, because as we all know, this can turn into a very serious situation, coma and or worse of an outcome than what happened for me and my father that day. But a couple of things I learned. From now on, with all of my diabetic patients, there's 3 questions I'm going to always ask them at the beginning of their appointment. One of them is, when was their last meal that day? Did they actually eat a good meal? And if they did, how long ago was it? This is really important because a lot of times, depending on when their meal is that day, or when their appointment is that day, they may have skipped the meal. In my father's case, he had had breakfast, but he had skipped lunch because he had already brushed his teeth and his appointment was in the afternoon. Of course, he had taken his insulin that day. So when you take insulin and they have no food, of course, their sugar levels bottom and plummet. The other question I would ask is, what was their glucose level today? And did they take that before they ate, and before they had eaten, and before they had taken their insulin? If it's in that lower range, especially for men, of 120 and lower, there's a good chance that if they haven't eaten, that's going to drop rather quickly. And to know if they're already starting to head in that direction, you want to ask them how they're feeling and continue to ask them that throughout the appointment, especially if they seem a little lethargic or quieter than what you're used to, because they may be already headed in that direction. So you can have some orange juice on hand, which I highly recommend, or apple juice, even a pop. But they need about 15 grams of some type of a simple carbohydrate in order to increase and spike that blood sugar level back up and keep them from getting worse. The other thing that you could actually ask your patient to bring is a glucose emergency kit like this. My father does have one, this is his, but it was unfortunately at home. So we could start to ask them to do that. And make sure your emergency kit in your office does come with some glucose gel. That worked really, really well and was worked rather quickly. So I hope that this tip and this situation that turned out good, fortunately for me and my father, helps you so that you can avoid, and helps me down the road, avoid any possible future hypoglycemic situations. Thanks, and stay inspired.